Hello and welcome to the EduTalk Diabetes series hosted by Easy Diabetes Dry Skin Therapy Lotion and Foot Cream, Biotone, and diabetes health and wellness experts. With the daily challenges of diabetes and interest in health and wellness strategies, the EduTalk Diabetes series supports building your wellness community by connecting you with diabetes health and wellness experts who share their knowledge and expertise on topics of concern to provide you the tools and resources to support and manage a healthy diabetic lifestyle. Today's expert is Adrienne Asta, who began her massage career in 2001. She's the current president of Massage Therapy Foundation and chair of Community Service Grants Review, and serves on the foundation's development and marketing community. Additionally, Aiden's an NCB TMB approved educator, certified in neuromuscular therapy and prenatal massage. Let's listen and learn as Adrienne discusses key benefits of recent evidence-based research supporting massage therapy benefits diabetes. Understanding that over 480 million people globally are challenged by the effects of diabetes, and this is a number that's on the rise, massage therapists can play a vital role by providing therapeutic massage services to improve and encourage diabetic health, wellness, and healthier lifestyle choices for their diabetic clients. We have a lot to cover. Adrienne, welcome. Thank you for joining us.
Thank you.
And everyone, thank you for having your sound muted and your video off. Feel free to chat questions or comments during Adrienne's presentation, which will be answered at the end. Thank you, Adrienne, again, and I'll turn the screen over to you. See you on the other side.
Thank you, Danelle, and thank you especially to Biotone. Biotone, I was telling Danelle and the Biotone team, Biotone has been, with me since the birth of my, even massage education. So have high respect for the company, and I am so grateful, not only as the president of the Massage Therapy Foundation, but as the chairperson of the Community Service Grant Review Committee for the foundation, that Biotone sponsors 2 grants for our community service grants every year. These are people who can never say thank you to Biotone, the people who are being served. So to me, that says a lot about the company. So I appreciate you having me on and chatting a little bit about this condition that affects almost half of the adult population of the United States. So it's about 30 million in the US, about 84 million are pre-diabetic. So we're looking at, most likely, we are going to be massaging someone who is either pre-diabetic or diabetic. There might be somebody on the table that has this condition. So our writing committee, chaired by Andrea Windsor, Andrea has written an article that's going to be coming out in Massage Magazine and Massage Today in November. November is Diabetes Awareness Month. So be on the lookout for her articles. And a lot of what we go over today will be sourced from the articles that Andrea wrote. So it's important to know that even though this is a endocrine disorder, right? So a disorder of the pancreas, whether it's not producing enough insulin or the insulin isn't getting to its right place in the cells in order to for the body to function properly. It's important to know that the impact on the body is mostly cardiovascular, and that is where we as massage therapists really need to pay attention. We're seeing great results of body work being applied to diabetics and pre-diabetics in a really supportive way. So I want to talk about just a few of those. And as a side note, this particular condition is really close to my heart because my father passed away from diabetes complications. So I do know firsthand how this is how this can be effective and how massage therapy can help. So I'm gonna be referencing some notes because there's so much between all of the stats that are out there and whatnot. But even dating as far back as 2001, we found that Swedish massage really helped to decrease the blood sugar levels, the blood glucose levels. And this is a key component that we need to pay attention to, because if our clients are diabetic and on the table and we're giving them massage, there is a chance that their blood sugar is going to drop because the body is able to absorb that glucose like it hadn't before. So when we are planning to massage a diabetic client, it's really important for us to be cognizant of the cycle that they're in their if they're insulin dependent. We want to make sure that their blood sugar is the most stable. So for example, if they're taking insulin every 4 hours, probably halfway through that cycle is a good time. We don't want it to be too high. We don't want it to be too low, because we can have detrimental effects as far as the outcome of the massage, and all of the symptoms that come with hypoglycemia, as far as dizziness, fainting, etc., can happen. So communication is really important with your client who has diabetes. They are the ones who are going to be able to tell you how they feel when they're starting to get hypoglycemic, or what protocols they do. Some have orange juice, some have little candy that they suck on and bring their blood sugar up right away. I have a type 1 diabetic client currently, and the technology that's out there is amazing, where she wears a monitor and her phone goes off when her blood sugar gets too low, and we're able to course correct in the middle of the massage if we need to. There has been studies that show that diabetic neuropathy, which is prevalent because of the breakdown of tissues in the periphery, and those really fine capillaries break down. We don't get the right blood supply to the extremities. This is where we see diabetic ulcers, foot ulcers, wounds that won't heal. Of course, this is something we need to be aware of, as far as not wanting to bring infection to an open wound, especially in an area where for a client where wounds don't heal. But we want to still be able to increase some circulation and some neural activity to the extremities, because there has been recent studies that have shown that massage of the foot and massage of the hands really helps to increase this circulation to tissues that are having some trouble on their own getting some circulation. The foot massage is also contributing to helping diabetics be more aware of their balance. So because of the neuropathy, especially in the lower extremity, we see diabetics who are off balance a lot. So this is really scary sometimes for diabetics who are feeling like they're going to tip over, feeling like they're going to slip and fall or trip and fall, because they can't feel the earth under their feet. So bringing that mindful attention to the lower extremity really helps the people who are suffering with peripheral neuropathy maintain their balance. And this increases their mood, which is something that we like to measure in massage. It decreases their depression, which is often associated with diabetes because it really does wreak havoc on the body. People with diabetes do know the detriments that are happening. So having a partner in their wellness journey is really crucial to the success of their symptom management. Okay, so while massage helps to decrease depression, increase balance, increase tissue healing, uptake that blood glucose into the cells, it is important to know that massage doesn't cure diabetes. So we want to make sure that we are clear in communication, but certainly we can help our client feel better, and we can help our client move easier. And we know that movement is really a key component for managing diabetes. We're looking at increasing of range of motion, increasing overall blood circulation to support bringing the cells out of the bringing the sugar out of the bloodstream and into the cells. We're looking at myofascial stimulation that helps to increase the elasticity of tissues. Reduction of fascial restrictions is key to supporting movement. And when we move and we have increased range of motion, our client is really, they feel a freedom that they don't feel when there's restriction. The manual stimulation of tissues feels like a relief to a diabetic, especially when they're having trouble with movement due to either peripheral neuropathy or access, a sedentary lifestyle. So showing them that they can be in their body and that it feels good to move is part of that partnership that massage can be for this population. There's also a nerve sensitivity that gets increased with massage. So I think one of the beautiful things about massage is that we get to show the client in their own body where they are having pain or discomfort, or there's something that feels good or not as good, or hey, most of us are familiar, hey, I didn't even know that this was bothering me here. So being able to catch a symptom early, even before we might be aware, is really key to informing other healthcare providers, their nurse practitioner or their endocrinologist or their primary care physician, how it gives them information to report sooner than maybe if they would have been aware, because of the damage to the nerves beforehand. And of course, massage helps with reduction of stress and increasing relaxation. And this seems lofty, right? Oh yeah, we're just going to reduce the stress. We're just going to reduce the stress. But stress is such, it tips the seesaw. So if you imagine a diabetic trying to regulate, because of the compromise of their nerves, because of the compromise of their tissue health, because of the compromise of their capillaries in their kidneys and their eyes, we often some of us refer to that as trying to balance two elephants on a seesaw, right? So you think it should equal out, but really, like, one small move can really throw something in another direction. So there's stress with that. There's anxiety with that. What's going to happen next? I thought I was doing everything right. I thought I was taking my medications the right way. I'm seeing my doctor. I'm exercising. I'm doing all of these things, but we still have an upset to the system. So the stress hormones then really increase from that anxiety, and then it starts a whole cycle of effects that are detrimental to not only humans who don't have diabetes, but more so ones who do because of the compromised systems. So that therapeutic relationship is not one that really should be ignored, as far as it's not only the manual benefits of what we do, but also the psychosocial benefits of what we do as well. Unfortunately, this is a condition that disproportionately affects socioeconomically challenged and ethnic groups, minorities, underserved populations. A lot of that has to do with access, right? Access to healthy food, access to nutrient-rich food, lack of education and understanding of how the body works, how food is used as fuel. So we see a lot of comorbidities, especially in that population. But the combination of body work with all of the other care really helps to relax the body, maintain blood flow. It keeps our heart rate down. Our oxygen saturation is better. So we're looking at a whole host of overall well-being. There is some room for us to continue to study how often should they get treated, how long should the treatment be, how intense should this pressure be. And this is something that is not unique to massage and diabetes. This is dosing and length of time and the amount of times. This is a next step in massage research, and we're looking forward to being a part of that. I'm looking at the time. It looks like we got about 9 minutes left. I just want to check in to see if anybody has any questions at this point. I know I've been throwing a lot of stats out there for you. All right. So the Massage Therapy Foundation has been providing massage therapy community service grants to a host of populations that are underserved. And like I said before, Biotone sponsors 2 grants per year, and we're really thankful for that. In particular, in 2010 and 2019, we funded a project that delivered massage therapy to diabetes in underserved urban and rural indigenous regions in Mexico. And the goal of that project was to enhance the skills of the local massage therapist to be able to serve an underserved community. So you can find more about that on the Massage Therapy Foundation's website at massagetherapyfoundation.org. And as far as for those who want to learn about the benefits of medical massage for this population, we have some resources that we are going to send to you, and you'll be able to see some of those resources that we leaned on. All right. Any other questions so far?
I'm going to jump back in.
Sure.
Excuse me. I'm sorry. Excuse me. That's oftentimes massage is seen as a luxury.
Yeah.
And how is the awareness of massage benefiting diabetic health getting out there? Is that working? Is that an opportunity that when you're working with your physician to ask, what else can I do? And would they think massage?
Yeah, I think our diabetes patients are seeking complementary care to to the current medical system, because they are seeking to be soothed, right? And they're seeking to feel more in their body, especially when they're, you know, in moments that feel out of control sometimes. So I'm unsure about the statistics of anyone, not just diabetics, asking their primary care physician about massage, but it certainly has significantly increased over the years. And what about massage for this? What about massage for this? I can tell you from my personal experience that primary care physicians and physical therapists are probably the ones who advocate for massage most in my area. And we are noticing that thanks to organizations like NCCIH, the efforts that the Massage Therapy Foundation is doing to send out the information and research, send out the research that we do, just to let them know about the host of benefits that massage therapy can have, and certainly diabetics can help with that as well. You know, massage and diabetes is it's really about encouraging the client to keep going. It's, you know, especially in the times when they want to give up. It seems like a long haul. It is a long haul for some. There are times when that neuropathy can be really painful. And if massage can help take some of that pain away in order to live a higher quality of life, I think anybody would choose to have that. So I would absolutely encourage, if you know anyone, even the people who aren't on your table, if you know anyone, have them ask, you know, is massage therapy something that we can do?
I wanted to go back to the foot massage.
Yes.
Because I've received massages
Mhm.
and my feet are part of that, but it's not reflexology.
Okay.
So there's a difference between just part of a massage being a foot massage,
Mhm.
and maybe at the end of the session, and specifically reflexology. And how would reflexology make a difference? Is that too much for someone to take on with diabetes, or do you have any answers for that?
Every person's story is a little different, so therefore their tolerance is going to be a little different. What massage, whether it's kind of a general Swedish technique, if it's myofascial work of the foot, if it's reflexology, there's a host, a spectrum of modalities, most likely, that we can name. Each person's story is a little bit different. So open communication about the ability to tolerate pressure, the ability to tolerate the length, right? You know, there are certain times, if you and I reflect on massages that we've gotten, I've had therapists who worked a little too long in an area, and I have healthy tissue, right? So what we want to do is just keep our lines of communication open about tolerance. It's good when it feels good, and it's not good when it starts to feel bad. So we want to make sure that we're communicating that we want to hold out. We don't want to over-treat an area, and over-treatment looks different depending on tissue quality of that person. And as much as we're putting diabetes in this box, you know, there's 30 million people with diabetes. There's probably 30 million different lengths of foot massage and foot modalities that you can do. So that's one of the reasons why we want to look more about length and pressure and dose. But that has to be in an implementation study, you know, where it's real people getting real massage, you know, in a real setting, you know, not in this kind of siloed clinical setting. So that takes a while. And it's, you know, it's important and necessary work. So I would just say to all the massage therapists out there, keep your communication open around diabetic ulcers and impaired skin for a diabetic. for those who are massage adjacent, recommending a massage therapist who might have some extra training or is confident about treating people with diabetes is the way to go, and just encouraging diabetics to seek massage will be absolutely supportive to their wellness journey.
Adrienne, I don't remember from the last time you were on that the Massage Therapy Foundation had an opportunity for therapists to contribute what they're learning through their practice during massages to the foundation. What is the name of that again? And if anyone's listening, they're a massage therapist and they want to participate and share information regarding their diabetic clients, would that be a fit?
Absolutely. So we highly encourage every therapist to do a case report, right? So a case report is one therapist, one client over a series of at least 6 treatments. And there's information about writing a case report on our website. And we have opened a practitioner case report contest that anyone who wants to apply for that, you can inquire about how to do that. So that's the easiest way to contribute what you're doing in the treatment room to the industry. But then there's also the opportunity to be a part of our practice-based research network. So a PBRN is common in healthcare, where we get to share with local researchers and other medical providers what we do in the classroom in a less formal setting. But then also if there is somebody who's researching about massage therapy effects and blank, fill in the blank. If you are part of MassageNet, if you're signed up for MassageNet, which is free, and I highly encourage you to do it, we are going to be able to reach out to your zip code, your area code, zip code, and say, yes, hey, everybody in this zip code, we're doing this study. Are you interested? And you can elect in or not elect in. So, there's no commitment being a part of MassageNet. There's only things that you're interested in. So I highly recommend joining our practice-based research network at MassageNet. You'll see a link on massagetherapyfoundation.org.
Okay. I was going to ask for the website, so thank you for covering that. massagetherapyfoundation.org. And I do not see that any comments or questions have come in, Adrienne. I want to thank you. And before closing, I'd like to mention the upcoming EduTalk Diabetes series that we have in August 15th. We'll have Linda Lockett-Brown presenting on meal planning for diabetes, more than carbs. And in September 19th, we'll have Nathan Lesh presents Protect Your Feet, Prevent Diabetes-Related Amputations with Effective Foot Care. So we have some great EduTalks lined up for the rest of 2023, and watch your in basket for invitations, as well as tomorrow, please watch your, I call it an in basket. I think I should move along with the times, the inbox, for a follow-up email of tonight's presentation with Adrienne. It will have a recording link. There will be a handout in the email follow-up, and also Adrienne's contact information if you do have questions offline that you would like to direct towards her. Again, please join us for future upcoming EduTalks. Thank you so much for being part of this tonight. Thank you, Adrienne.
Thank you.
And anything in closing?
If you have any questions, feel free to shoot me an email, president@massagetherapyfoundation.org.
Thank you so much. Thank you, everyone, for joining us. Be safe and see you next time. Take care.